There are nearly 330 million people in the United States. 13% of them are African American. So why is it that this minority makes up the majority of all deaths from COVID-19?
Disparities that have plagued this city, this nation, that are all about fundamental inequality, are once again causing such pain and causing people, innocent people, to lose their lives. It's just abundantly clear. It's sick. It's troubling. It's wrong.
Here in New York, black people are twice as likely to die from coronavirus than white people. It is true that those from poorer backgrounds are suffering more. But these figures raise more questions than provide answers, and understanding why this racial disparity exists means acknowledging historical inequities. The pandemic has exposed a divide in the health of Americans and its inequality with roots dating back over 400 years. The slave trade came to the United States in 1619 and went on to divide the nation during the Civil War. In 1865, the 13th Amendment finally brought an end to slavery.
I still have a dream this afternoon.
But for black Americans, that was just the beginning of a long fight for democratic equality. In the last few years, there has been a rise in race-driven hate crime. Black people killed in situations where there is no provocation. Scenes of unrest serve as a reminder of an enduring internal battle that exists within American society.
That there are two kinds of systems in America, one for the rich and wealthy, and one for the poor and people of non-color.
Bishop Seabrooks was born and grew up in New York, Brooklyn. He now leads the service at the Rehoboth Cathedral. He says he's watched the effects racism has had on the people around him his entire life.
Institutionalized racism, it is sophisticated racism. You don't say you're prejudiced. You just, number one, you don't educate blacks like you educate white. Okay? By sophisticated racism, it allows the schools of African Americans to have some good teachers, but not enough of the services that they need to cause them to excel academically. You put the better teachers in the white areas and the bad teachers in the poor areas. So the good schools in the Caucasian areas, such as Brooklyn Heights or Dumbo, those kids are already furnished with computers and laptops. In the schools in Bedford-Stuyvesant, most of them are not. So it is institutionalized racism.
The bishop blames the problem on the misrepresentation of African Americans and on money.
It's all about race and economics more than human life. You will find that in many of the hospitals that exist in the African American community, sometimes poor health care is given. You go to the city, the New York Presbyterian Hospital, oh my goodness, the treatment, the rooms, the professionalism of the doctors and the nurses is totally different than Brookdale and Bed-Stuy-Stuyvesant, or East New York it is. Brookdale is in East New York, and where people are dying every single day coming in with conditions. Bodies piled up in, number one, in U-Haul trucks on top of each other, all right? But that was done again in the African American community.
As a group, African Americans have higher rates of poverty, unemployment, and chronic medical conditions.
Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts.
There are many factors that contribute to poor health, including living conditions and lack of clean water. And without decent health coverage, things are even tougher. There might be some healthcare provisions for people who don't have health insurance here, but there is no universal healthcare system here in the US, and that means the treatment here is different depending on how much money you have. And it's not just about access. Many people will also say the healthcare system is riddled with institutional racism. In 2002, the US Institute of Medicine released a report. It found that racial and ethnic minorities receive lower quality healthcare than white people, and concluded that some were more likely to die simply because of their race. Alfred has driven a New York City bus for more than 20 years. His story is one of someone working on the front lines, exposed to the virus, but also of someone who tried to get help and was turned away more than once.
When I initially went to try to see my doctor, they weren't taking patients at the time because of what was going on. So they kind of pushed everybody to go to urgent care. So I went to urgent care when I started feeling like that. And they checked me out and they told me, oh, you don't have any flu symptoms. They sent me home.
He was prescribed ibuprofen, a drug now known to worsen the symptoms of coronavirus.
They gave me a prescription for inflammatory, ibuprofen, which is the one thing you're not supposed to take. But I didn't know that. I went to the hospital. They checked me out. They told me that I had pneumonia. So doctors at that hospital was telling me that's where the shortness of breath is coming from, the pneumonia. So they sent me home. They didn't keep me.
After more than a week of desperately trying to get assistance, he managed to speak to his primary care doctor, who told him to go straight back to the hospital.
When I got to the hospital, they admitted me pretty quick. They kept asking me to walk with them, but I couldn't walk too far without getting tired. So they said, well, we're gonna keep you.
Alfred spent several days in hospital. He was given oxygen. His situation just kept getting worse, and he asked for a ventilator, but he was told he didn't need one. At one point, he thought he was going to lose the battle. He had no communication with any of his family members. He was unable to talk on the phone due to the shortness of breath. Alfred pulled through, but some of his colleagues weren't so lucky.
I'm very fortunate to be here with you guys. Actually, I'm very blessed to be here. There was several of my coworkers that didn't make it.
Carol McCoy is from Brooklyn. She's a religious minister and a community leader. She considers herself lucky because she has healthcare, but she doesn't believe that it's a fair system.
I believe healthcare in the United States is horrible when it comes to certain classes of people. Overall, for the African American community and the Latino community, it is horrendous that the healthcare system, it does not work for us. It's not available and affordable for our community. As African Americans and as Latino people, as we work hard and educate ourselves and make ourselves more marketable, the same benefits would apply. But for those who have not had that opportunity to go to college, to better themselves, and to receive better paying jobs or careers, you suffer the consequences of receiving the back end of what society has to offer you. I've experienced, I would say, some unfairness in my places of employment when someone who is of Caucasian descent could come in and they're in a position above me. They're making way more money than I have. You can't speak to anyone about it. It's just how it is, you know. You can't complain. They'll look at you like, be grateful you have a job.
When COVID-19 hit New York, like millions of others, Carol was sent home from work. Carol wasn't concerned about coronavirus. She stayed home and felt relaxed. And then she started watching news, and reality set in. People were dying. But she still didn't think she had anything to worry about, but until it was her own family members who started to become sick. Her brother came over to bring groceries to their mother. Days later, he became sick. And then Carol's mother started to get symptoms too. Her brother's condition worsened and the ambulance was called.
The EMS came. They called EMS to the house for him. They would not take him.
Carol's brother was finally taken to hospital on April 1st. Several days later, he died.
On April 3rd, my mother started experiencing shortness of breath. This sounds like coronavirus COVID-19 symptoms. So my sister Sabrina and my niece Erica, they cleaned up my mom and they dressed her and they rushed her to the hospital at North Shore in Long Island. And once my niece Erica took my mother to the doctor, the nurse put her in a wheelchair and rolled her off, and we were never able to see her or communicate with her again.
For more than 2 weeks, Carol received updates on her mother's situation via doctors, until April 20th, when she received the call that her mother had passed away. Carol says the white funeral homeowners didn't know how to do African American hair, and instead of calling the family to ask for help, they simply covered her with a scarf.
They even admitted, we're sorry, we just didn't know how to put her together the way we should have.
Remember, for every crisis, there's an opportunity.
Yeah.
Okay, please.
Yes.
Okay. All right. Okay. Thanks, Carol. I'll give you a call.
It's time to pray. We're not a divided borough. We're not a divided city. We want to see our community healed.
The bishop says he's lost count of how many people come to him complaining they've been a target of racism. But he wants this church to be a safe place where he can support his community. But he also wants to change.
Government has the responsibility of meeting the needs of the people. So the first thing that they have to do is better health, better jobs, more education, all right, and equity, okay?
Not everyone in the projects are bad people or criminals or violent. So I just would ask them just to be more empathetic and more sympathetic. I'm not sure if that is a word that the government would ever consider. God has called us as a people to be compassionate and to be empathetic towards one another.
The United States is a country rich in diversity, so often called the melting pot, where people can be whatever they want to be if they work hard. It's the American dream that everyone's desire, but in a country where one race is dying at twice the rate of another. Success, for all seems, a far-fetched idea. COVID-19 has reminded Americans that the fight for equality is far from over, and that building a stronger society starts with keeping people healthy. In the midst of chaos and suffering, caring for each other, no matter what race or religion, is now more important than ever.